Ever think diabetes is strictly a daytime concern? As you diligently track your carbs and monitor your sugar intake by day, have you ever pondered what diabetes is up to at night? What if I told you that while you're dreaming, diabetes could be giving you signs you shouldn't ignore? Our mission today is not just to inform, but to enlighten. We're unmasking the 12 diabetes nighttime signs you can't ignore. You might be confident in your daytime diabetes management, but what if the true challenge is when the sun sets? Ignoring these signs isn't just detrimental. It's a mistake even the most vigilant among us have made. And some of these signs, they're more insidious than you'd think. Prepare for an eye-opener. This journey will be enlightening and, dare I say, essential for anyone battling diabetes. But before we venture further, if you value empowering health insights, do us a favor. Hit that like button and subscribe to our channel. And trust me, you'll want to stay until the end. We've got not one, but two invaluable gifts tailored for those serious about understanding and combating diabetes. Research in the Journal of Clinical Sleep Medicine found that nearly 50% of people with type 2 diabetes experience sleep problems, including symptoms that you would typically only notice at night. Let's talk dollars for a second. According to the American Diabetes Association, the total estimated cost of diagnosed diabetes in the U.S. is a jaw-dropping $327 billion annually. That includes medical costs and lost productivity. But can you really put a price on good health and a good night's sleep? With such compelling data, especially that shocking number from the Journal of Clinical Sleep Medicine, it's clear that diabetes isn't taking a break while we're catching our Z's. The cost, both financially and personally, is too great to ignore. I urge you to stick around because today we'll unravel the 12 diabetes nighttime signs you can't ignore. This information is not just useful, it could be life-saving. Are you ready? Let's kick things off with number 12. Snoring. Now, listen closely. Snoring might seem like just a nighttime nuisance that annoys your partner and maybe even the neighbors. But what if I told you that this seemingly harmless act could be an early warning sign of something much more concerning? We're not just talking about disrupting a peaceful night's sleep. According to research published in the journal Sleep, people who snore regularly have an increased chance of developing insulin resistance. Insulin resistance is one of the major red flags for diabetes, and it's something that you really can't afford to ignore. So what's happening in your body when you snore? Well, each time you snore, you're actually experiencing brief interruptions in your breathing. These interruptions can activate stress responses in your body, leading to a spike in stress hormones like cortisol. Elevated levels of stress hormones can mess with your blood sugar levels, creating a chaotic environment for diabetes to flourish. If you're dealing with snoring, there are a few things you can try before hitting the panic button. Simple lifestyle changes like losing weight, cutting back on alcohol, and even switching up your sleep position can sometimes relieve snoring. Ever tried sleeping on your side instead of your back? It might just make a world of difference. But if you've tried these tricks and you're still snoring like a freight train, it's time to take things more seriously. You should consult a healthcare provider for a comprehensive sleep study and potentially a diabetes screening. This is crucial, folks. It's always better to get ahead of the problem than to play catch-up later, especially when your health is at stake. So the next time you catch yourself or someone else snoring loudly, don't just roll your eyes and try to block it out with a pillow. Think of it as your body's own alarm system, signaling that it's time for a checkup. Remember, you're not just snoring. You could be revealing a clue about your health that's too significant to ignore. Our next stop on this list is sleep disturbances. Now, I'm not just talking about tossing and turning or having an occasional nightmare about missing a deadline. I mean the sort of disturbances that jolt you awake and keep you up, tossing and turning in a state of restless agitation. According to a study in the Journal of Sleep Research, sleep disturbances could be closely linked with poor glucose control, thereby exacerbating diabetic symptoms. If you're waking up repeatedly or having trouble falling back asleep, this might be your body waving a red flag. Solutions? Well, aside from making your bedroom a haven for sleep by using dark shades, white noise machines, or practicing relaxation techniques, sometimes these issues need to be discussed with your healthcare provider. persistent sleep disturbances may require deeper investigation and potentially medication to regulate your sleep patterns. Now, let's shift gears to number 10 and talk about leg cramps. Anyone who's had a leg cramp knows it's like having your muscles gripped in a vice. Imagine experiencing that when you're trying to rest. But did you know these painful leg cramps could actually be linked to high sugar levels in the blood? That's right. When your body can't balance sugar and electrolytes properly, cramps can ensue. To relieve leg cramps, you might try hydrating properly, doing light stretching exercises, or even massaging the affected area. However, if leg cramps persist or become more frequent, it's crucial to consult with a healthcare provider. It could signify an imbalance that's far from trivial. Sweating bullets in your sleep. Well, you've made it to sign number 9. Night sweats. While sweating can occur for a multitude of reasons, from having a nightmare to sleeping in a warm room, it could also be indicative of low blood sugar levels, known as hypoglycemia. There are some home remedies for night sweats, such as adjusting your room's temperature, using breathable fabrics for your bedding, or even taking a cool shower before bed. But if you're experiencing persistent night sweats, it's critical to talk to a healthcare provider. Your nighttime sweats could be your body's way of telling you that your blood sugar levels are dangerously low. Trust me, this is one sign you don't want to brush off. We've arrived at sign number 8. This one is especially intriguing, yet often dismissed. Dry mouth. Imagine waking up in the middle of the night feeling as parched as the Sahara Desert, even though you've been comfortably snoozing in your climate-controlled bedroom. Now, this is not just about a simple nuisance that a sip of water can resolve. Dry mouth, medically known as xerostomia, can actually be a glaring indicator of diabetes affecting your salivary glands. According to research published in Diabetes Care, there is a relationship between the presence of dry mouth and elevated glucose levels. And let's talk about the consequences. If not addressed, dry mouth can pave the way for more serious dental problems like cavities, gum disease, and even oral infections. Now for the relief part. You can opt for sipping on water throughout the night or chewing sugar-free gum to stimulate saliva. There are also over-the-counter saliva substitutes that can help temporarily. But if you find that this symptom persists night after night, you must consult a healthcare provider. Dry mouth might be the tip of the iceberg, signaling underlying health concerns that require a comprehensive approach for treatment. As we proceed further down this list, our next pit stop brings us to a crucial yet overlooked nighttime sign. Vision changes. Yes, I'm talking about those moments when your night vision seems fuzzier than usual or when you struggle with adjusting to darker environments. This is not a sign to ignore, folks. Published studies in ophthalmology have demonstrated that persistent issues with vision can be early warning signs of diabetes-related eye complications, like retinopathy or even cataracts. These issues can have lasting effects on your quality of life and shouldn't be dismissed as mere annoyances or attributed solely to aging. So, what can you do if you're experiencing vision issues? First off, ensure you're getting ample eye rest. If you're staring at screens before bedtime, consider blue light blocking glasses to minimize eye strain. A balanced diet rich in vitamins A, C, and E can also go a long way in maintaining eye health. But if you notice consistent changes in your vision, especially at night, it's time to book an appointment with an eye specialist for a thorough examination. Vision changes can serve as an advanced notice from your body that something is going awry internally. A comprehensive eye exam will not only evaluate the health of your eyes, but can also flag potential systemic issues that you might not be aware of. Remember, it's better to be safe than sorry, and when it comes to health, prevention is always better than cure. Alright, let's pivot to a sign that might not even be on your radar. On number 6, restlessness or irritability. Now, this isn't just about having an off night or a grumpy moment. Listen closely. Studies have shown a direct correlation between diabetes and mood swings. According to research published in the journal Diabetes Care, depression and symptoms of irritability were more prevalent in people with diabetes than those without. Astounding, right? Think about it. You're trying to unwind, but there's this unexplainable restless energy. Maybe you're snapping at your loved ones or feeling generally unsettled. Could it be tied to your diabetes? Elevated blood sugar levels can actually mess with your body's neurotransmitters, affecting your mood and even causing restlessness or irritability. A study in psychoneuroendocrinology revealed that glycemic variability could be linked to mood disorders. For relief, the best course of action is to maintain balanced blood sugar levels. This can be done through medication, proper diet, and regular exercise. Behavioral therapies like cognitive behavioral therapy have also been effective in treating mood symptoms related to diabetes, according to a study in the Journal of Diabetes Research. But if these symptoms persist, consult healthcare professionals for a comprehensive diagnosis and a tailored treatment plan. Your emotional well-being is just as important as your physical health, especially when managing diabetes. Let's shift gears to something a bit, well, sweeter, but not in a good way. Fruity breath odor is our fifth sign night. An unusually sweet or fruity breath odor could be due to ketoacidosis, a serious condition that could be life-threatening if not treated promptly. If you or someone around you notices this kind of odor, it's crucial to seek medical attention immediately. No home remedies can substitute the urgency of professional medical care in such a scenario. This is a red alert, folks, and should not be taken lightly. Now, let's quench our thirst for knowledge with nighttime frequent thirst, the fourth sign we're focusing on today. Now, if you're guzzling down water bottles at night like you've been lost at sea, listen up. Frequent thirst, particularly at night, can be yet another telltale sign of diabetes. Elevated blood sugar levels draw moisture from your tissues, making you thirsty. To manage this symptom, you'll need to keep your sugar levels in check. Monitoring your glucose levels and adhering to a diabetes-friendly diet can help. But if you find that the Sahara-level thirst persists, it's imperative to consult with a healthcare provider for a comprehensive analysis and a tailored treatment plan. Kicking off our final trio is nocturia, or in layman's terms, the annoying habit of frequent urination during the night. Now, it's completely normal to wake up once or maybe even twice to use the restroom. However, if you find yourself trekking to the bathroom more often than that, your body might be signaling a deeper issue. According to research from the Journal of Urology, nocturia has been associated with higher glucose levels in the body. Yes, your nightly bathroom trips might be more than just a nuisance. They could be a red flag for diabetes or even its complications. Now, the practical steps. You can reduce fluid intake a couple of hours before bedtime and avoid diuretic substances like caffeine. If the situation doesn't improve, it's essential to consult a healthcare provider for a thorough evaluation. Trust me, your sleep quality is worth it. Next up on our list is something that not only disrupts your sleep, but also puts you at greater health risks. Sleep apnea. Yes, those pauses in breathing at night might not just be snoring's more annoying cousin. A study published in Chest Journal has linked sleep apnea with insulin resistance, a precursor to diabetes. Sleep apnea doesn't just affect your rest, it can wreak havoc on your entire body. Seeking a professional sleep study can pinpoint the severity of your sleep apnea and determine the best treatment options for you, which may include devices like CPAP machines or even surgical procedures. And now, the moment we've all been waiting for. The number one sign you absolutely cannot ignore. Nighttime hypoglycemia. This is not just another symptom. It's a critical, immediate concern that requires your utmost attention. Nighttime hypoglycemia occurs when your blood sugar levels plummet during your sleep. This is extremely dangerous and could result in severe complications, including seizures or even a diabetic coma. Studies in diabetes care have highlighted the stealthy nature of nighttime hypoglycemia, where individuals may not even wake up despite experiencing it. So, how can you protect yourself? First, regular monitoring of blood sugar levels is key, especially before bedtime. Second, having a balanced meal or snack before hitting the hay can stabilize your blood sugar levels. Third, set alarms to check your blood sugar during the night if you're at risk. But here's the caveat. If you're experiencing symptoms like sweating, heart palpitations, or even vivid nightmares, consult your healthcare provider immediately. This is not the time for self-diagnosis or internet remedies. Your life and well-being are on the line. Alright folks, we're reaching the end of our deep dive into the 12 diabetes nighttime signs you can't ignore. We've covered a lot today, from snoring to the much-feared nighttime hypoglycemia. Trust us, your body has a language, and those nighttime signs could be its way of ringing alarm bells. So, what's your next move? Will you listen to what your body is trying to tell you, or will you risk missing these critical signals? Make your health a priority. You owe it to yourself. Now, if you found value in today's video, go ahead and smash that like button. It helps us reach more people like you who need this crucial information. Also, if you haven't already, hit the subscribe button and ring that notification bell. That way, you'll never miss out on future videos that could be just the eye-opener you need. But wait, there's more. Remember those 2 amazing gifts I mentioned at the beginning? Just check the description box below and click the link to access. They're our way of saying thank you for sticking with us through this critical journey. So, go ahead, claim your free gifts, and start making positive changes in your life today. And hey, if you've got any thoughts or personal experiences related to tonight's topic, please feel free to share them in the comments section below. Your insights could make all the difference for someone struggling with similar issues. Alright, that's a wrap for today's video. We'll be back soon with more eye-opening content that empowers you to live your healthiest life. Until then, take good care of yourselves and each other. Stay healthy.